I'm JoAnne Owens-Nauslar, and I'm privileged to do some speaking engagements during National Hospital and National Nurses Week. These are the things that I want to share with you. We've fortunately been privileged to use the Bryan health systems. My late husband, Red Nosler, was here for a number of things, from heart to renal to cancer kinds of things. And out of that, I've learned some amazing things about who you all are and what you do. And it's my perception that from the cleaning crew to the cafeteria to the doctors to the nurses and everyone in between there that has some kind of a title, that you understand purpose, passion, and mission. So number one, I want you to understand that you are valued and appreciated. We are blessed to live in the Lincoln community where there are amazing medical facilities. Part of my message to the group is to secure your own mask first. Just like the flight attendant tells us, in case of emergency, take care of yourself before you try to help others. That's a reminder that I need to do for all people in the medical profession and for myself. We have to figure out that in order to do our best, we have to try to be at our best. So we need to be able to get up every morning and run to the morning mirror and holler, "You sexy thing, don't you ever die." And the reason is there's too much work and fun to be done. Now, our faith structure lets us know that at some time we're going out, but we hope it's not in the near future if we still have work to do. So some reminders are, number one, to get up every day. John Gordon would say in his book, The Energy Bus, that you're the driver. I understand things are going on around us, and we have to try to figure out how to mitigate all that, bring it all together, and still show up here in the Bryan Health Systems with purpose, passion, and mission every day. So number one, decide that you get to be the driver. Number two, that business of desire and vision and focus. I've encountered people who are very focused on who they are and what they do. And for those of us who need your services, that's a blessing. So I thank you for that. My point number three is the value of cardiovascular exercise. I encourage people to walk off the job. Now, if you're in the ICU, we probably don't want to walk out of there, but we have to figure out how is it that we move to improve. We've learned so much in the last 10 years in my field of health and physical activity about the power of brain development, meaningful movement, rhyming, rhythm, repeat, to remember kinds of things. So a message to all of you is to make sure that you go for a walkout, a wake-up walkout, something in your day's time so that you'll do what's good for your heart, lungs, liver, brain, and bones. Don't forget your eyes, your skin, and your kidneys, and your hips, and your tummy, and your hiney will be just fine. Some of my other points are about this business of energy. I need you to approach each day with excitement, enthusiasm, energy. My late grandfather, along with my mom, taught me some things about why we would go to work. Number one, because we get to, and number two, because it makes a difference. And I would say to my grandpa, "Grandpa, will I ever go to work?" And he said, "Oh, sweet pea, I think you will." I said, "How will I know what I'm supposed to do?" He said, "You find something that you love to do so much, and even if you weren't sure if anyone was noticing, maybe if there are no awards and no rewards, you'd still do it because you loved it so much. And in your head, your heart, and your gut, you knew you were making a difference." That's called passion. My grandpa, Pfeiffer, taught me about passion. So I want you to think about every day. Get up, count your blessings, be dressed, be in the moment, figure out how to start another terrific day to excel. My good friend Doug McCallum would say, "You don't have great days, you make great days." And for a lot of us, that's true. There are circumstances around us that we have to figure out how to mitigate with purpose, passion, and mission, and go on to some next steps. I appreciate the value of what each one of you brings to your job. If I don't have a clean room, that can impact me as I'm sitting there as a patient advocate. If the food doesn't meet the desire of the patient, if the medical team doesn't do their job, the greeting team when you come in the place to even get registered, when I call here to find out where's the plaza or whatever. Those kinds of things, they never get a second chance to make a first impression. And I will tell you, over the 35 years that we have needed the services of Bryan Health, you're amazing at that. And I want you to understand that. And each of you has a role in that. You may not be the person at the front desk, but how you greet and treat that person may impact how they're there. Every one of you has value. We need to be valued and we need to be appreciated. We have two basic needs, a need to be needed and a need to be noticed. And if every one of us, every day, as we went around, made sure that we thought about 3 people, how can I make their day better? In the words of Coach Rhonda Revelle, she says, who might need me today? If we thought about that somehow, it kind of changes our energy, and especially if we're not having that great a day, when we give some of our positive energy to someone else and know that we've made their day, that can change our energy. John Gordon, in his book, The Energy Bus, tells us your energy can travel 8 to 12 feet. We've all experienced that. Boy, if we've been around a poopy person who may just be having a bad day, I'm not talking about mental health issues here. Please don't confuse that. I'm just talking about stinking thinking kind of thing. And if we've been around a person like that, it can impact us and it can drain our energy. So it is up to each one of us every day how to be, like the late Don Clifton would say, to figure out how to fill your bucket. Because we may have holes poked in our bucket that drains out our energy. But we have to live in a peak performance body enough to figure out what are those bucket fillers that get me back up to full. Because if I start here at 7 a.m. and I've got a 12-hour shift, somebody may need me with high energy at 5:30 when I only have hopefully an hour and a half to go. They may need the same energy as the person who caught me at 7:10 when I was just fresh off of sleep. It's about the power of energy, and each one of us has a responsibility to figure out how we do our bucket fillers. I need you to know that you're amazing and that every one of you has an important role. And if each one of us does our job with a 10+, this place continues to get rave reviews, they continue to do well by you, and we are all blessed. You are valued and appreciated, and I want you to have an amazing day, amazing week, and amazing years. Thank you for who you are and all you do.